Well, good morning, everyone. I'm Joe Reardon. I'm the president and CEO of the Greater Kansas City Chamber of Commerce, and I want to thank all of you for joining us today for this important briefing on something that, quite frankly, we had hoped to have under control when the pandemic began almost a year and a half ago. We know that the elected officials on this call right now, too, had certainly hoped that. All of us had. But here we are 15 months later, and the Delta variant of COVID-19 is running rampant throughout our community on both sides of the state line, quite frankly. Our area businesses are looking at another period of uncertainty. While they were able to bounce back this summer, the rise in cases and a more transmittable strain of COVID, combined with cooler months ahead, is going to present new challenges. Many have exhausted their relief efforts, and understandably, business owners are worried about what's coming next. And of course, to create more of a challenge, school starts soon. In fact, some districts in the region start as early as next week. Our economy, our workforce, our families, they're stretched thin. And we believe it's time to act now by slowing the spread and getting more Kansas Cityans vaccinated. We've convened this briefing today with our region's chief medical officers because they have urgent and vital information on the latest strain of COVID, transmission rates, and more. This is an opportunity for these medical experts to speak directly with our elected officials and local leadership that have joined us on this call. In fact, these chief medical officers have asked us to help convene all of you so they can provide you with this updated data and other information that can help you make key decisions about stopping the spread. We know the challenges of our elected officials, business owners, and school leaders. You're facing these challenges as you make tough decisions to protect all of our health and safety. This group of chief medical officers also knows that feeling, and they're here to provide you with the most up-to-date information on the challenges we are all facing in the weeks ahead. I'm glad to see so many of our leaders here today on this briefing to listen to the men and women who are leading this fight against COVID-19 on the front lines of our Kansas City region. Just one note to mention as we begin: when the CMOs are finished with their presentation, we'll be taking as many questions as we can during this conference. But you can also send questions to info@kcchamber.com, info@kcchamber.com, and we will get you a response. So now it's my pleasure to turn this over to Dr. Stephen Stites, who's the Chief Medical Officer at the University of Kansas Health System. Dr. Stites?
Joe, thank you. And thank you very much for helping us with this conference today. And to all of our elected officials and school board or school administration members and city administrators, et cetera, legislators, we just want to say thanks for being a part of this program today. And thanks for taking time to listen to our message. You know, chief medical officers are not the folks who really seek the spotlight. And we sort of toil behind closed doors and work hard to try and keep our hospitals safe and our patients healthy and strong. But sometimes things happen that are of an extraordinary nature. We came to you twice before, once last November and again after that, to speak to you about the rise in the dangers of COVID-19 and what was going on inside our health systems. And each of those times we had an urgent message. And today we are back, and our message, I think, is more urgent and more vital than it was last fall and winter when we came to you at that time. This is an extraordinary time in our lives and in our community, and the Delta variant has changed the game. And we want to let you know what's going on inside of our health system. As you do develop questions today, please feel free to put them. There's a Q&A section of this meeting, and Dr. Tim Williamson will be here. He is our Vice President for Quality. He'll be helping to answer those questions. And we'll also have time, I hope, at the end to try to answer some. The chief medical officers have been meeting for over a year, about a year and a half. And what we do is we have a phone conference, and we do it once a week. And sometimes we do it 3 or 4 times a week when things are really tough. And what we know is that we have learned, we've worked great together. You should be proud of how competitive organizations have come together to learn and help and talk with each other. What we're going to do now is reflect on how we do that. You're going to hear our CMO, we call the roll call, where we go through how things are going. And I'll be introducing each of the chief medical officers who are on this today. And as they speak, they're going to go through the same things we do every week, so we stay in touch and we know what's going on. The first person I'm going to turn to now is Dr. I got to get to my list on the roll call. Dr. Raguadega, the CMO at Liberty Hospital. Raghu, how are things up north?
Thank you, Dr. Stites. Well, at Liberty, like all other area hospitals, our bed situation is a little bit tight this morning. Currently, we have 32 patients with COVID in-house. That's about 1/4 of our med-surg capacity. And 7 of them are in ICU and 3 are on the ventilator. All but 1 of these patients are unvaccinated, and mostly they're younger. Nearly half of them are in the 50s or younger. And there is 1 in 20s, 1 in 30s, and many without serious comorbidities. Currently, we have 17 staff who's not working due to COVID, and we're at capacity for all patients, but we manage with bringing in extra staff to take care of these overflow beds and ED holes. That's how we typically manage to minimize refusing patients from transfer or going on diversion. So we're doing okay with these extra staff that we had to bring in.
Yeah, but more than that, it could be problems.
Yep. We're very, very close, and we have had to go on diversion on many times in the past weeks, and this hasn't happened in a while.
Dr. Batrash, how are things at the Kansas City VA hospital?
It is this similar scenario here as well. So we currently have 14 inpatients with COVID. 4 of them are in the ICU, and none of these are on the vent, luckily. As far as the outpatient side, we have 100 that is active with COVID now for veterans, and that is actually triple the amount of patients we had 2 weeks ago, just 2 weeks ago. So over 2 weeks, we tripled the outpatient number for sure, and on the inpatient side, that is also triple as well. For employees out due to COVID, we have 17 total. As far as the bed capacity and staffing, we are very tight as well. We have only 2 ICU beds available, for example, today, and a couple med-surg beds, and that's it. And we've been on diversion, bed diversion for multiple times over the past couple of weeks, and that is definitely alarming for us as well. Not finding also beds in the area to transfer patients when we don't have beds. That's also another issue, and we get a lot of requests for transfers, for inbound transfers, and when we don't have the beds, we have to turn them away. So that's a problem. We do have. Yeah, go ahead, Steve.
No, you go ahead.
Yeah, as far as the deaths due to COVID, we lost since the beginning of the pandemic 77 veterans to COVID, and actually 68 of them are in-house here at Kansas City VA and 18 outside. And of all these, only 1 was vaccinated. So clearly there's a significant rise in the deaths of the unvaccinated for sure, and that's kind of expected, and we know that the vaccine saves lives. So it is preventable deaths, and this person who died from being vaccinated had multiple comorbidities, end-stage renal disease, on dialysis, and very elderly gentleman, and it was kind of expected.
Thank you. And just a note, I mean, tripling your outpatient numbers suggests if that's the sign of what the transmission's like in the community, that means we've tripled it over the last 3 weeks. And just to say from our own outpatients here, our own staff here at KU, that's about what we've seen. We've tripled the number of COVID positive staff. We're over 100 now. And out of our 12,500 employees, that's a really high rate of infection. Dr. Lisa Hayes, how are things at Advent Health?
Very similar to what everyone else is seeing in the city. When I took over this position at the beginning of July, we had approximately 8 inpatients, and now we're up to 34. Today, we have 8 in the intensive care unit, and we have 6 of those are on a ventilator. We are having staffing shortages throughout the hospital. We don't have at this time a nurse to take a planned procedure later in the day. We will come up with that person later. We currently have 15 employees that are on quarantine from COVID. Approximately 75% of our hospital staff is vaccinated. However, in July, we had 26 employees that were out with COVID, and all but 5 of those were unvaccinated. Currently inpatient, about 87 to 95% of our of our patients are unvaccinated. And the majority of the people that we are seeing in the intensive care unit in the ICU are not vaccinated or severely immune compromised. Our hospital census at midnight tonight was 289. We had 6 transfers that had to be declined because we didn't have nurses to take those patients overnight. And we have 9 patients holding in the emergency department waiting for a room today.
I call that full. That's tough.
I think so.
Dr. Bill Gilberts at St. Luke's. How are things there at St. Luke's Health System?
Thank you, Dr. Stites. Across the health system, currently we have approximately 129 COVID positive inpatients, the vast majority of which, of course, are unvaccinated. We have approximately 33 patients in the ICU. In general, we're experiencing high volumes across the system, but not just from COVID patients. Some of the volume is a result of people having delayed care over the last 18 months. Regarding our workforce, we're starting to see more impact compared to earlier this year. We currently have 50 out due to confirmed COVID. Looking forward, we're concerned about the increases that we're seeing in our ED visits, and that doesn't seem to have any slowdown in sight. So just like everybody else on this call, we're trying to manage these very high volumes, but it's been a real challenge.
Yeah, that is. Now, you guys had a special situation at St. Luke's East. Can you talk a little bit about that?
Yeah, St. Luke's East has really experienced a consistent and concerning volume increase since about the 4th of July. It's a much younger demographic than we've seen previously, and a lot of these folks are from the southern part of the state, including transfers from Springfield and, of course, Lake of the Ozarks. 94% of them have been unvaccinated. To give you an example of the growth we've seen, between June 3rd and July 3rd, there was a 32% increase in cases, but between July 3rd and August 3rd, we've seen a 69% increase in cases. Most recently, this July, 47% of those cases have been 60 or older, but nearly half, 49%, are between 20 and 59.
Yeah, that's tough. Mark Steele, Truman Medical Center. How are things?
Hey, good morning, Steve and everyone else. Well, currently here at Truman University Health, we have 55 patients in-house. To give you some idea of the increase that we've experienced, back on July 9th, we only had 20, and in June, we were running in the teens. This 55 is very close to our high of 62 that occurred during the winter peak, and about 95% of those currently admitted are not fully vaccinated. We have a number of these patients who are very sick, with 17 being in the ICU and 5 are on ventilators. During July, we had 12 COVID-related deaths. 3/4 of those occurred in the final 2 weeks of that month, and our highest numbers that was our highest number since January. We unfortunately had 2 more COVID deaths overnight. None of these deaths were in fully vaccinated individuals. We currently have 40 workforce members who are out due to COVID, and this is more than 4 times higher than it was 3 weeks ago. Like everyone else, we're currently running very full. We're holding 7 admitted patients in the ED awaiting a hospital bed, and staffing our available beds continues to be a considerable challenge for us.
Thank you. Dr. James Stewart, CMO at North Kansas City.
Good morning, Steve and everyone. North Kansas City, we're in the same boat. We have a total of 72 COVID patients in the hospital right now. 13 of them are in the ICU, and 9 of those are on ventilators. Of the COVID patients in the hospital, 90% are unvaccinated, and none of our vaccinated COVID patients currently are in the ICU. We have 34 employees out now with COVID, which is up from under 10 a couple of months ago. And our staffing, we're over 90% capacity for staffed beds. In terms of deaths, since the beginning, we've had a total of 283 deaths from COVID. So we're all feeling the, yes.
It's tough. Thank you, sir. Dr. Daryl Nelson, Health System or HCA Midwest Health System CMO. How are things?
Good morning, Steve, and good morning to everybody. Daryl Nelson here. I'm the Chief Medical Officer at CenterPoint. I'm reporting on behalf of our Division Chief Medical Officer, Dr. Kim McGow, and our 7 area hospitals, which include Belton, CenterPoint, Lee Summit, Lafayette, Menorah, Research, and Overland Park. We have currently 145 patients in our health system who are COVID positive. Of those, 46 are in the intensive care unit, and of those, 24 or 17% are currently ventilated. We've seen a significant increase, just as everybody else has been reporting, Steve, and the rate of rise has been unsettling to all of us. As far as COVID vaccinated patients, typically the trend is somewhere between 3 and 8% of those who are in the hospital, so it's a significant minority. And I know, as we've all been sharing, it continues to be a story really about the unvaccinated population that is seeking care and certainly needing higher levels of care at our institutions. As far as our system, I would say we're managing so far, but like everybody else, we're uneasy about the trends. We're currently at 94% overall staff bed capacity across those hospitals. And then specifically within our intensive care units, we're at 95% capacity. So, Steve, I think it's a similar story here with kind of right on the edge about our capacity situation and uneasy about the trends. So we're grateful for the opportunity to share in this conversation today.
And thanks, Daryl. We're glad to have you here. Dr. Elizabeth Long is the interim CMO at Olathe Health. How are things out south?
Things are well. Good morning. I'm actually the actual CMO now.
Congratulations, I think.
Hey, good job. There you go. So as we've been talking over the last year, things have definitely gone up and down. We were just cruising along at 0 to maybe 3, 4 COVID patients. And then now we're up to a whopping 25. And I'm reporting for both Olathe Medical Center as well as Miami County Medical Center. We have 8 in the ICU, 2 are on ventilators. And so what that means is a drastic increase for our health system regarding that. Our percent vaccinated patients, we have 19% at Olathe, which is a little bit higher than what you guys are reporting, and 25% of the COVID patients at Miami County have been vaccinated. But that number at Miami County is 4 patients. So one of them is vaccinated. Now, what we are seeing with those vaccinated patients is actually a decreased length of stay in the hospital, as well as a decreased acuity. We're not seeing those patients having to reach the ICU and doing the ventilator. The only one person that we have in the ICU that's been fully vaccinated is somebody that has chronic lung disease that is on oxygen at night. As far as our employees, we definitely are seeing an increase in the uptick of our employees out with COVID. We have a total of 11 when we were going with none for quite some time. And about less than half of those were vaccinated as well. Our bed capacity, as far as that, our ICU is absolutely full. We do not have one more bed to give to anybody, and we have 1 bed open on the floor at this time.
Thank you. Tough numbers once again. Dr. Jennifer Scrimshore is infectious disease specialist at Lawrence Memorial. How are things out west, or sort of west?
Slightly west. Thanks, Dr. Stites. Today, we currently have a total of 7 COVID patients, down from 9 a couple of days ago. 1 of those in the ICU, none are on vents. We only have 1 hospitalized patient that is vaccinated. We currently have 13 employees out for one reason or another, either positive or quarantine. That's up from about 2 a couple of weeks ago. Our staffing is, like everyone else, maintaining or reaching capacity. We don't have any ICU beds, at least unless we flex to another unit. We've had to open our COVID unit, and our overall bed capacity for the entire hospital is closer to what we see in the winter. We still have beds, but as everyone has said, it is a struggle to get staff. And that has been maybe our primary worry for the past, few months. Yeah, that's it. Thank you.
Thank you. Dr. Jennifer Watts is the Medical Director of Emergency Preparedness and the Director for Global Health at Children's Mercy. How are things?
Yes, good morning. Thank you for having us as well. Children's Mercy is definitely seeing an impact from COVID-19 as well. We hit an all-time high this morning with 19 patients in-house positive for COVID-19, 7 of those receiving care in our intensive care units. We also have had staff out just like everybody else. Over the last couple of weeks, we've had about 30 new positives in our employees per week. That's definitely a drastic increase from where we were, 3-4 weeks ago, where we were less than 5 per week. So we're definitely seeing the increase in our staff as well. Our patients are not yet eligible to receive vaccine, a good chunk of them. So we do not tier them out based on fully vaccinated and not, but hopefully that will be coming soon. And I'll talk a little later too, but we've definitely seen an increased rise in viral illnesses, including RSV. So we are running pretty full most days. We are still able to take care of kids that show up and that need attention. But we are juggling some on a daily basis to figure out the best ways we can do that, because we are running pretty full in-house most days.
Yeah. And that is our consistent story, isn't it? Here at the health system at KU, we have a total of 46 patients, and a number of those, I forgot the exact number here, that are in the ICU. 10 are in the ICU, and I believe 7 are on ventilators right now. And one thing to point out is that we've had a total of 452 COVID-related deaths since the beginning of the pandemic. We've had 282 who have passed away inside the hospital. 4 of those were vaccinated, but that means 278 were not vaccinated, and the 4 who were vaccinated were all very severely chronically ill. The other problem we're all having, and you heard it today throughout, is that we are not being able to accept many patients to the transfer center, and that's a struggle. Today we have 808 patients here in our hospital, and that includes staffing alternate care areas like the dialysis unit or the endoscopy unit as inpatient beds, and we have 20 patients or so in the emergency room with orders waiting for a hospital bed. So it's safe to say your hospitals are on the verge of a real crisis here, because we don't have a lot more beds to give to this rising number of COVID patients we're seeing. When we came to you last fall and said, we have a problem, we had about 270 COVID patients in our hospitals, and we were fearing the surge. Today, we are at 376 amongst the core 6 hospitals. Core 6 are the ones who've been giving us their numbers every single day. It's more than that if I included everybody, but that 376, the number of hospitals that relates directly back to the numbers in the fall. And that's 100 more than when we came to you the last time. So we are in the midst of a significant crisis. So I want to talk a little bit about that, about how full our hospitals are. And I'm going to turn first to Dr. Jim Stewart, who is the CMO over at North Kansas City, and to all of our presenters. Because we had a longer roll call, we probably only have 2 minutes per slide. So just remember that as we roll through these. Jim.
Yes, thanks. This is a map that shows all the hospitals, main campus of all the hospitals in the region that's represented on today's call. And even with satellite campuses, you can see that we're all full, and this extends to the entire region. And the ripple effect of that is that when the hospital's full, then people get stuck in the emergency room waiting for a bed, as several people have already mentioned. And that causes the emergency room to fill up, and the waiting room to fill up, and the wait times to go up. And a hospital can go on what's called a high volume status, which means the capacity in the emergency room is dangerously high. The problem is, if more than half the hospitals in the region go on high volume status, then the Regional Healthcare Coalition can force everybody to be open again. And this force open order has been rare in the past. In fact, in the previous 9 years, it's happened once. But in July of this year alone, the force open hours have been over 1,200 hours. So you can see that everybody's in full, and the effect from having a full hospital is having a full emergency room. And we need to stay open for the time critical diagnoses like heart failure or heart attacks and strokes and trauma. And it's getting tough to stay open with that.
Thank you, Jim. And here at KU, we had 1,500 requests for transfer in the month of July. We denied almost 500 of those. So almost a third of them we had to deny. That's tough. And what it is, those are often time critical diagnoses, people looking because you have a heart attack or stroke. And man, when you can't get to an open bed right away, that's time's wasted. And so that's heart tissue that is destroyed, or that's brain tissue that's destroyed. And so I think what we have to recognize is that that because hospitals are full and they're just busy right now, and you've had patients coming back to care who had delayed their care, that we are all really busy. And then you put the COVID on top of that. And what it means is we're struggling to get people taken care of. We're struggling to do it in a timely fashion. And as this pandemic continues to worsen, things will really deteriorate inside our health systems. And we don't want to see that, because we want to be able to take care of folks. Mark Steele, talk to us a little bit about how our positive 19 cases are very close to prior highs.
Yeah, so this slide shows the 7-day rolling average of COVID cases here in the metro area over the course of the pandemic. And obviously the largest spike in cases to date occurred over the winter, as you can see. You can see where COVID restrictions were implemented early on during that spike that ultimately helped flatten the curve. We were doing quite well over the spring and early summer, once again, as you can see, and the mask mandates were lifted. And then, unfortunately, the Delta variant arrived on the scene, which we know is much more highly transmissible than the prior strains that we had encountered. It appears more likely to land you in the hospital and to have more severe illness. This resulted in a rapid rise and acceleration of the new cases over the last 3 to 4 weeks. As you can see from the slide, about a 10-fold increase overall since the beginning of July. This, of course, hasn't been helped by lower vaccination rates in our area and folks being unmasked and out and about more since the mandates were lifted. Now, the good news is that the vaccinated individuals are 8 times less likely to contract COVID and 25 times less likely to be hospitalized and die. And the vast majority of vaccinated individuals who become infected are either asymptomatic or have very mild illness. But we now know that with the Delta virus, that vaccinated individuals who are infected can carry viral loads in their noses similar to those that are unvaccinated. And as a result, they can pose a potential risk of transmission to others if they're not masked as well. So as already highlighted, we've successfully blunted the curve before. We can absolutely do it again. And the quickest way to do that is to get everybody masked up, particularly in those high-risk indoor settings. And of course, continuing to chip away at getting more folks vaccinated as quickly as we can.
I think that's exactly right. And it is a scary curve when you look at the shape of that curve and see it looks just like it did last fall. You know, when we were here with you before on November the 5th was our very first CMO conference with our community. We can go to the next slide. At that point, our 7-day average in Kansas City was 695. Today, the 7-day average is 737, so it's even higher. And yet we've tried to do all the things we could to tamp it down. And we've even tried to say, how can we back off elective surgeries again? Well, guess what? A lot of those elective surgeries are really not elective. They're cancer patients, they're heart patients who need to have their surgery. It's folks who've already delayed their care. We're already seeing a later presentation of breast cancer, colon cancer, and others because people were scared to come to the hospitals. So really, it's hard to say we're going to delay surgeries again. And most of us have already shifted all the stuff we could out to the outpatient setting to the outpatient setting. So the reality is that what we have in hospitals are some of the highest acuity indexes any of us have seen in our hospitals for a very long time, if ever. And so what you have are systems who are doing their very best to keep up with the demand, but are teetering on this precipice where, because of a lack of public health measures, we do not have the same safety precautions out in place. And with the rise of the Delta variant, which is so much more transmissible, it leads to trouble. And we know we're especially at risk because of this low vaccination rate. So Dr. Petrash, take us through these slides, or this slide.
Sure. So looking at this heat map for the entire United States, you see we are in a hot zone here for COVID, clearly. So it's across the Missouri and Kansas, Missouri a little bit more than Kansas, but you look at the rest of the states where it's really hot zones, we know what's happening in these states. It's the vaccination rates is really low. And so typically when you see the vaccination rates being low, when you see the masking is not done as much, so typically this is when we get those hotspots, and data is really proving this. You look at this other side of this slide where the risk for the unvaccinated, obviously, so the darker color is really higher risk, and you see that purple color there. Sorry for the code red.
Unfortunately, the code red, raw clear did not clear the map here.
Did not clear the map at all. And I would say the map is still in active code red for sure. So obviously, again, this is driven by two main things: low vaccination rates and low number of masked patients indoor. So to combat this, we know what to do: get vaccinated and wear your masks indoor.
Yeah, and remember, the threat to all of us is that if we can't get time critical diagnosis in because we're full of COVID patients, all of us lose from that. It's not a question of vaccinated or unvaccinated. It's a question of all of us are at risk. And then if you look at the rise in the COVID numbers, they're really occurring in an unvaccinated population, but it can occur in a vaccinated population too, which is a little bit of a concern. Let's take a look first, though, at the daily new COVID-19 hospitalizations. And Dr. Long is going to walk us through this slide.
Thank you very much. First of all, I want to take your attention to the fact that these are daily new hospitalizations. So that doesn't count the patients that are already in the hospital. And as you can see, in July, that number is drastically going up in a very steep curve and is looking very similar to the January of 2021. And that is very concerning for us. And so, as we have stated before, the COVID patient takes a while in the hospital. It's usually not just a 2 or 3 day stint in the hospital, although with vaccinated patients who do get COVID, their length of stay does tend to be less. And so that is an ongoing issue because you're stacking patients on top. And so then you have no bandwidth, you have no beds. And that, as we have discussed, translates into we can't take care of patients. We can't transfer them. We can't accept transfers. And other patients, people are losing out with this. In addition, we are having to implement surge plans. And that definitely puts a stress on all of our hospital systems. And so I think that this is a very telling slide. Thank you, Dr.
I think you bet. I think it is a very telling slide. And what we know is that rise in that curve is as steep as it was last fall. It's got us scared, and we're much more full than we were last fall already with people who don't have COVID. So our ability to absorb that capacity is so reduced, which means those with time critical diagnosis are going to suffer. And so that is a struggle for all of us to take on. Now, we didn't know about the Delta variant the last time we spoke, but we've learned more about it. Dr. Adega, talk to us a little bit about this increased transmissibility of the Delta variant.
Thank you, Dr. Stites. This slide is one of those slides that was recently released from the internal data from CDC. As you can see on the graph there, on the x-axis, when you go to the right, you'll see diseases that are a lot more infectious. That means that they spread a lot more quickly, a lot more contagious diseases. On the left are things like seasonal flu. On the right most is the measles. That is the most infectious that is known to humankind. The number on the bottom is what's called R naught. That means how many people can one infected person infect in turn. So when you look at seasonal flu, it's about a little over 1. When you look at the original version of the coronavirus that we had, that was somewhere around 2. When Alpha came, it was a little bit higher than that, about 40% higher. But Delta that you see there, that is about somewhere between 5 to 8 or 9. So one infected person can infect anywhere between 5 to 9. That is a lot more infectious, a lot more transmissible than what we had seen before, which is closer to chickenpox. Now, what's the reason for that? We know a couple of reasons, and more will be known as the data comes along. We do know that people who carry Delta compared to the original strain carry about 10 times the virus in their respiratory tract. The viral load is higher, and they carry it for a longer period of time as well. So those are two main reasons, and we'll obviously know more. And what is the bottom line with all of that? Especially when you have a virus that's a lot more infectious, that means the mitigation measures need to be a lot more stronger, not weaker. That means you're going to have to reduce the number of susceptible people to control it, which is vaccination. And then we need to bring in other mitigation measures, wearing masks, especially indoors, and those are the kind of things. That's the only way we can reduce the number of infections and somehow bring about herd immunity. They do say that the herd immunity for Delta has gone up what we need to control it, unfortunately.
Yeah, and part of it is that if you'd had COVID before, it may not protect you as much against the Delta variant. You know,
Exactly.
it's interesting. This data,
We are hearing second infections quite a bit now.
Yeah.
Is there a number we need to reach that's been added?
A number that we need to reach of vaccination. Yeah, I think it's about 80 to 85% is what we need to achieve to get vaccination safe. And the vaccination still works against severe illness and death. And but the prediction is now that 85% of people need to be vaccinated in order to really control the spread of the Delta variant and return us toward a much more state of normalcy. And that data from this slide is interesting. And a lot of it came from Provincetown, Massachusetts, which is on the tip of Cape Cod. And in Provincetown, they have a 95% of the folks who have been vaccinated. They only had 2 people positive for the entire month of June. July the 4th comes, a lot of tourists come in, and now they've had 1,000 people positive. So a really much more difficult time. I want to turn now to Dr. Nelson, who's going to talk to us a little bit about how the number of deaths could also start happening and could easily increase. Daryl?
Yeah, thanks, Steve. Well, this is an unfortunate slide and a commentary to have to share, but I think it's critically important. 2,458 of our fellow citizens have succumbed to COVID in the Kansas City metropolitan area. So it's a very real local number about the impact to the community in which we all live and work. I think what's important to know about the death patterns and the death rates is that they are unequivocally impacted by vaccination. There is clear data, even with the evolution of the Delta variant, that we can protect our community from the ultimate sequelae of this illness, which is death, loss of life. We've also seen that even in the presence of the evolving numbers that we've talked about and the fact that our overall death rates have decreased, our concern is that'll be a continued trend that will be unsettling for us if we don't make some progress quickly on masking and on vaccination. The other corollary that I think is relevant, as you've heard this discussion evolve, is that deaths from other diseases are starting to show unfavorable trends as well. And it relates to access to healthcare, patients concerned about coming in, fear of contracting the illness. And so I think there are unintended consequences of other health issues that we're also seeing in our health system, as you've alluded to, Steve, that are allowing to become more advanced as well. So it's not just a story about the death rate from COVID itself. In addition, that small subset of vaccinated COVID patients who do succumb typically have significant underlying illness. So there's no question that vulnerable population is even more so that in the presence of COVID. So we would just strongly encourage consideration for expanding the masking and vaccination efforts across our community, Steve.
Yeah, perfectly said. Thank you, Daryl. And we hear our numbers from the health system, just to be completely transparent. We have had 12 fully vaccinated patients pass away, but 8 of them died remote from their admission. So we're not even sure that was really a COVID death. 4 have died inside the hospital, which means out of the 261 deaths we've had inside the hospital, with 4 of those, that's about 3 or 4%. Which just happens to be exactly what we understand to be how protective the Moderna and Pfizer vaccines especially are against severe illness and death. And that's even with COVID or even with the Delta variant. So really important that we take that into consideration. And Daryl, your point about how we're all going to be affected, not just the Delta, not just COVID deaths, but all deaths, because people present later and later because they're afraid. Dana, Dr. Hawkinson is our medical director of infection disease and prevention and control here at KU. We've talked about death a lot, but what about the long haul syndrome?
Yeah, I mean, we know the acute impact, the morbidity and mortality with COVID-19. But we also do understand and know that there are long-term effects. It's that long haul syndrome or the long haulers or the post-acute sequelae of COVID-19, however you want to term it. And it continues to affect people after that acute stage. We've seen more and more research about that. There was a recent study from JAMA that looked at least 4 months after. And what they saw was that 10 to 30% of patients, and you can find these numbers in really any of the research, and it is pretty consistent. 10 to 30% of patients will experience sequelae up to 4 months or more after infection. And this is even with mild disease, not just severe disease. In this particular study, they had a pretty large cohort, and over 50% of the patients that they had studied had at least one symptom that didn't even exist before their COVID-19. And in addition to that, we saw that there were mental or cognitive symptoms. 20% of patients reported at least one cognitive symptom. When they were evaluated, they actually found cognitive impairment in almost 48% of those patients. Not only that, but we know it impacts your daily life and your ability to get through your daily life. Up to 30% of patients had anxiety, and 20% of patients had depression. So this affects people on a continual basis for the long term. We do have the multidisciplinary clinic here at the University of Kansas Health System. And so far, since February, we have had 344 unique patients. Since that time, data on about 320 of those we have, and 2 of those patients sought 6 specialties for assistance with their post-COVID symptoms. 12 of the patients had seen 5 specialties. 4 had seen 4 specialties. 51 had seen 3 specialties. 98 patients had seen 2 specialties, and then 157 had seen 1. So we see it's not just one person or one specialty that you're seeing, but it's a multitude of specialties. And this is consistent with other data around the country as well.
So long haul is bad.
Yeah.
All right, guys, we're going to run up against the wire here. So we have to go pretty quick. But Dr. Gilberts, there's some really important points that you need to make here about the capacity. Oh, hey, Bill, you got to remember to unmute. Remember, we said now you become a zombie.
Okay, now I'm here. Okay, about 90% of the hospitals in our region report moderate to significant staffing challenges. And the 34% of the hospitals report anticipated shortage in staffing next week. It's all about staffed beds, and this continues to worsen. Last fall and winter, the concern was ICU beds, but now it's total beds and rapid transmission. We need to take steps immediately to permanently stop this transmission. For instance, at KU, the previous transfer high was 1,200 in November. In July, or 1,500, and they were receiving 75 a day. Sadly, turning down approximately, I'm not sure how many, but a lot. And I know our St. Luke's transfer team turns down a lot of transfers because we simply don't have the capacity to take them. So it's because of the faster transmission of the Delta virus by both the vaccinated and unvaccinated. And because of that, we are having more stress. We don't have the staff to staff the beds, and we got to do something.
Thank you. Boy, I totally agree. So let's talk now with Jen Scrimshire. You're the infectious disease physician there at Lawrence Memorial Hospital. Jen's worked with us throughout this pandemic and helping keeping KU safe, which worked great last year. Masking works even for the Delta variant. Talk to us about this slide, Jen.
Yeah, we know that masking changes the course of the pandemic. And I can say that whether they're cloth or surgical masks, we know that at least a third of infections can be prevented just by masking. I like to say masks work. This is not debatable. There's numerous studies that prove this, but from our perspective, we've had no known cases of patient to staff transmission in our hospital, despite taking care of COVID patients. And about a year ago, when Douglas County was experiencing its first real surge of patients, we were able to decrease our average daily cases to a third of what they were just by asking our community members to mask when they were out in public. This is critically important as we bring back our college and university students and try to get our kids back into the classroom.
Yeah, thank you. I totally agree. And I think it is really important to note that the masking and things bent the curve before. Now we have vaccination. We need masking back to bend this curve, because your hospitals, folks, here in the Kansas City metropolitan area, we're in trouble and we're not able to take patients, all the people we can. That's time-sensitive diagnoses. They're struggling to get into our hospitals. And that means we are wasting heart tissue, wasting brain tissue. That is not the outcome any of us need. Now, there goes the echo again, guys. All right, let's turn now to Dr. Jennifer Watts. Jennifer, how are things at Children's Mercy? We have talked a little bit about that, but you guys are seeing a boon here. And what's different about this, a lot of the Delta variant COVID patients.
Yes, certainly. We are definitely seeing the increase in pediatric cases, both inpatient and also outpatient. Last week, we had 269 cases for COVID-19. That's both our inpatient and outpatient. But we also saw 259 positive for RSV. So we have this struggle. Typically, we see RSV in the winter, and we're seeing it now along with some of the other typical winter respiratory viruses. The concern we have is that doesn't mean that those aren't going to come back in the winter, because we are expecting influenza to be here this year, which we didn't have last year. So we are expecting influenza to be here. We're expecting some of these other respiratory viruses to be here. So with the rates we're seeing now of COVID-19 and RSV and some of the others, we are a little concerned. Little is definitely an understatement of where we're going to be in the winter, especially with schools reopening. I mean, if we, I think everybody saw how important school is for children. And, we think the top priority is for our children to be in school for so many reasons. And in order to do that, we have to have mitigation strategies in place. The rates of community transmission, the rates of vaccine coverage, both of those factors are key drivers in how many mitigation strategies and how much of the mitigation we need in place. The things like masking, hand hygiene, the routine cleaning frequently, all of those things work. But when our community rates are high and our vaccine coverage is low, we have to amp that up for our schools to protect our children. The best thing we can do to keep kids safe, those in school and out of school, is to cocoon them. Get them, have their cocoon, everybody around them vaccinated. If everyone around them is vaccinated, that offers a little bit of protection for those children, some of the youngest that are not eligible for vaccine. We are hopeful that in the upcoming months that we see, no one knows the timeline, but we're hopeful that we will see, vaccine become available for some of our younger kids. And we will certainly work to vaccinate the community as quick as possible and as soon as we have the green light. But right now, 12 and up are eligible. So that's definitely part of our population, and those children can certainly get vaccinated, and we strongly encourage it. But until the community transmission rates drop and our vaccine coverage increases, we do recommend, along with CDC and AAP, that, we do need these strong mitigation strategies in place to keep schools open.
Yeah, I think that's a really important point. If a school is choosing not to mask, they're really very much at risk to having to go right down the route they're trying to avoid, which is not having kids in school, right? I mean, isn't that one of your concerns?
Absolutely. There's so many factors, mental health, nutrition. There's so many issues that we need for kids to be in school besides just their academic performance. But it's part of kids' health, well-being, and whatever we can do to keep them in school, we 100% support.
Thank you. I'm going to turn to Dr. Lisa Hayes at Advent. Lisa, one of the struggles is that we have to remember that we're working on a Swiss cheese model where everything matters.
That's right.
I don't see the slide up there, but I know you know what it is.
I think it's the next one.
Okay.
There we go.
There you go.
So, I'm a visual learner. I love this slide. Basically, it shows that nothing that we do is 100% in preventing the vaccine, but all the things added together really reduce the chances of transmitting the virus. Starting on the left side, there's our personal responsibility, staying home if we're sick, using good hand hygiene, coughing into our elbow rather into our hands, wearing masks, not touching our face, avoiding time in crowds, particularly unmasked. And then we move more into our shared responsibility as a society, including, good ventilation and air filtration, good testing, good public messaging, and then quarantining and isolating. And the last thing that we individually are doing when we vaccinate is actually doing our civic duty to protect our other citizens who are either not able to mount an immune response to the vaccine or who are not able to have a vaccine because of their young age or perhaps of an allergy.
Thank you. So let me kind of summarize something, and then we're going to have time for questions, and we'll go over about 10 or 15 minutes if we need to answer all the questions. In the past, we bent the curve, and now it's coming back up. Now, we bent that curve, in all fairness, by masking and social distancing. What you're hearing from the chief medical officers today is we need masking back. We are not policymakers, but we are healthcare professionals, and we're telling you that inside our hospitals and health systems, we're at a critical juncture. The numbers are rising rapidly, and there is no end in sight to the rise unless we put public health measures in place. It would be great if we could get everybody vaccinated overnight, but even that would take 4 to 6 weeks before we could or even 8 weeks to see before it reaches full effectiveness. There is only one mitigation strategy that we're aware of that we know will work and can work because masking clearly works. We've bent the curve with that before. We can bend the curve again, but we need your help in getting us there. And we need everybody to try to wear a mask. So we're urging you to help us help our community and make sure that we can collectively keep our community safe from all diseases, not just COVID-19, but everything, whether it's a cancer diagnosis, a heart diagnosis, a stroke diagnosis, an infection diagnosis that's not COVID-19, a breathing problem. We need to get these patients in our hospital. If we don't have beds, we're all going to suffer from that. So we need your help, and we hope that you've heard our message loudly and clearly today. We do not want to look like Springfield, and we know that that is in our future if we are not able to blunt that curve. So with that as our presentation, I think, and I know there have been some questions. I understand from early on that Ed Eilert, I believe, is the chairman of the Johnson County Commission. Mr. Eilert, did you have a question for us today? And remember to unmute. I'm not hearing, but Tim, there are questions out there that you've been taking in the chat. What are some of the key ones that you've seen?
Yeah, there are all sorts of questions. They're great questions. We'll just throw out a couple of the big ones. One of the biggest ones is, what are we asking employers to do? Is there a call to action for employers, and particularly around vaccine and or mask mandates? Yeah,
that's a great question. So, as CMOs, we're not trying to make public policy, so we have stayed away from the term mask mandate. What we are saying is we need everybody masked, because we're in trouble from a hospital standpoint. So we're asking for your help in masking. And Dr. Adega, we know masking works.
Yes, absolutely. Masking works. I mean, there have been multiple studies, as it's been mentioned before, that reduces all sorts of respiratory illnesses. We all know we saw no flu at all last season. What's the reason? It's because everybody was masking. So there is no question. And I think indoor masking, as CDC has recommended for all workplaces, is absolutely essential, in my opinion. I think how you achieve that is up to the leaders in those organizations.
And so just to say, Raghu, also that, you showed that slide about the transmissibility. That was a leaked CDC slide that was presented last week. And we presented it to all of you today. But that increased transmissibility is what's making the Delta variant so dangerous. It doesn't really, some people, it may cause more death. We don't think that is so true yet. But it's because it can get into patients so easily and transmit so much more easily. If one person can infect 6 to 8 people as opposed to 2 or 3 people with the original strain, that puts everyone at risk, especially the unvaccinated population and children. Let's remember, Jen, this disease is affecting children now in much greater numbers than it did the last time, right?
Yes, absolutely. Our numbers Outpatient testing, our numbers combined, inpatient and outpatient testing has risen dramatically over the last few weeks. But if you look at our inpatients alone, we hit an all-time high of 19. That's 19 kids in the hospital that are positive for COVID-19, majority with respiratory symptoms. Our high number prior to this time was 13. That was when we were at our fall-winter surge when everybody was bursting at the seams. For the most part, during COVID-19, we have managed to stay well under 10, a lot of days under 5. So the fact that we are about, we hit 19 today, and we were at 12 yesterday. So we are climbing, and who knows where we're going to max out this round. But the more people we get vaccinated, the more people we can, get wearing masks to help protect our kids. I think the better off we're going to be.
Yeah, I think that is absolutely true. I understand that we're able to unmute Ed Eilert for just a minute. Ed, did you have a question? And remember, are we unmuted? We're working to get you unmuted, Ed. The people here in this hospital have to work with me, try to mute me constantly. So,
Doctor, can you hear me now?
We can hear you. Thank you.
All right. Well, thank you very much. Sorry for my lack of technical skills on this end. Thank you all very much for the important information that you have shared today. My question has to do with being able to provide information to share with community members that perhaps is more direct. Such as the number of unvaccinated patients, COVID patients in area hospitals specific to the hospital, rather than looking at it from a metro standpoint. And in my view, we need to have a better coordinated effort to convince those people who remain unvaccinated to get vaccinated. And so those are my two questions.
Yes, sir. Thank you, Ed, and thanks for being a part of this program today. I know that at our health system, about 5 to 10% of patients in hospitals are unvaccinated. That means 90 to 95%. I'm sorry, I said that wrong. Are vaccinated, only 5 to 10. That means that 90 to 95% of the patients we have hospitalized with COVID-19 are unvaccinated. Only 5% or maybe 8% are vaccinated. If you look at the patients who are coming in, and we look at this really carefully, we try to say, what is a patient who's vaccinated who comes in with COVID-19 like compared to those who are unvaccinated? And the answer is they have a much more severe burden of disease, which suggests that it's not so much that the vaccine didn't work against the virus, it's that their body did not mount a good enough vaccine response. So how does somebody who's immunocompromised, and here's the folks who have died for us. We've had one person who had lymphoma, failed bone marrow transplant, and had CAR T therapy and had end-stage lung disease. We had another person who had a kidney transplant, that kidney transplant had failed, was back on dialysis and died from COVID-19. We had somebody who was on dialysis with renal failure, diabetes, obesity, and hypertension, died from COVID-19. All those folks have been vaccinated, but all of them were so, as I said before in the morning media program, they were so sick that a raindrop might have pushed them over. So the problem is that when fully vaccinated, if you have a lot of other burdens of disease, you can't rely on just vaccination. So you know what we tell those folks? You know what we tell our patients to do? All of our patients with severe chronic illness who are vaccinated, we still tell them to wear a mask, which is exactly the message we're giving to our entire community right now. You're right. Absolutely. If we had everybody vaccinated, that would be great. But unfortunately, that's just not going to happen in a rapid enough time. I mean, the reality is we're just not going to be able to get that done. So what can we do to stem the tide, to bend the curve, and to make sure we keep our community safe? Because where we're being compromised is our ability to take care of not just COVID patients, but every patient, right? That's the ultimate problem. And hospitals don't have on-off valves. So people say, well, cut your elective surgeries. Right. Okay. So I'm not going to do that cancer surgery. I'm not going to do that heart bypass surgery. I'm not going to, the things we would have to do are still denying care to people. We're not taking transfers. We turned down a third of the transfer requests. Well, that's not who we are, but we have to, because we don't have bed capacity. We don't have staff to take care of those patients. And why is that? And what can we do to blunt the curve? there's only one thing we can do to keep your hospitals safe and open so that we can take care of everybody in this community. And that is, we got to put masks back on. We saw the slide from Dr. Scrimsher. Masking bends the curve, even with COVID. We saw the slide early in this presentation. The one thing that we know works, because it worked before, was masking. It's a simple act. Our folks do it here in the hospital every single day. We had 3,000 COVID patients. We haven't had in-hospital transmission of COVID. Why is that? We're masked, right? Masking works, and masking can bend that curve.
Thank you.
There are a lot of questions just about hospitals mandating or requiring vaccines for their employees.
You bet. Mark, okay. Truman has led the way along with the VA, so I'll turn to Ahmad and to Mark about, talk to us a little bit about your decision to move towards mandatory vaccination.
Yeah, I can speak from the Truman University Health perspective. And obviously, given the current COVID surge, we felt it was important for us to take the lead like we've done previously with testing and getting folks vaccinated. As healthcare workers, we all, of course, have the ethical and professional duty to protect others. And getting vaccinated is the one way to protect the health of our patients, the families, and the broader community. We know that the vaccines are extremely safe and effective. They've now been administered to over 190 million Americans. And as a lot of people know, requiring COVID-19 vaccines is not a new concept for healthcare facilities. And we've long required that our workers get vaccinated for other infectious diseases like influenza and hepatitis B. And so we thought it was appropriate to take this step.
Dr. Adega. I'm sorry, I did this again. Dr. Batrash. I've known him for like 20 years. I keep
Steve,
doing
no
that.
problem.
My apologies.
I'm going to try not to take it personal. Don't worry. We're at the VA. We have across the nation, the secretary of the VA actually took that really courageous step in mandating the vaccination for all the employees, for starting with the Title 38 employees, which means doctors and nurses are all included in that. They're working on the rest of the employees, and there's actually federal mandate that I can speak to just a little bit. Obviously, our mission is to keep our veterans safe, and the best thing we can do to keep them safe is, in addition to masking, which is still essential, is to get vaccinated. So we have vaccinated already 79% before even that mandate. 79% of our employees are vaccinated. However, now we're hoping to reach 100% very soon. As far as the federal mandate, as you probably all heard, President Biden took the decision also to implement some mandate for federal workers. All federal workers are mandated to be either vaccinated or to submit to testing if they are routine testing, if they are unvaccinated. And there's some regulations being worked about that. So this also applies to any federal worker across the federal system, not only in healthcare. But we are hopeful that in the VA, that all employees, not only Title 38 employees, will be mandated also to be vaccinated. Of course, there are some exemptions, such as medical or religious exemptions, which are quite few.
Thank you. And just say here at KU, we have not yet had a mandatory vaccination policy in place, but I think that, something that we are continuing to work on. We also know that the worst kept secret in the Food and Drug Administration is that the Pfizer vaccine will probably be fully FDA approved on September 1st or thereabouts. I think that's a game changer. And I think we'll see a lot of organizations respond to that. And I think Moderna won't be too long beyond that. And I just want to say, the FDA is not rushing to judgment about that. The difference is, and the reason they're getting it done in 3 months instead of the normal 6 to 12 months is they've just taken other members of the FDA who would be working on other drugs and had them look at the same volume of information they would have had. They have over 100,000 pages of information that relates to the millions and millions of doses of vaccination that have been given in this country. And so plus probably 1 billion or so worldwide. So the FDA they've just expanded their bandwidth to get through the same amount of information they would have gotten through anyway. So I think the FDA is being very, very careful with trying to get these things done, but I think they feel the pressure to get it done. And their response to that has been to put more people on the approval process. And I think you know that they're going through all the information carefully, because if you look at the J&J issues around manufacturing, Novavax just said yesterday they're not sure they're going to get their FDA authorization because the FDA has questions about the manufacturing process. They told Moderna they had to give them more information before they would go further down their road on the approval process. So the FDA is doing their job. And I think what we're going to see is that these vaccines, I know we're going to see that the vaccines are very, very safe.
Even with children, they've asked for more people,
more
children in the studies
about the myocarditis question. So,
and to identify any other rare events that may occur.
And just one other shout out here: the public health officials in this community are nothing short of remarkable. I was on a call last night with the Unified Government Wyandotte County, and just to say, Dr. Alan Grinder, Dr. Aaron Corvo, Julie Lavu, I mean, you all are doing the God's work right there in those areas to try and keep the public safe. And I think these great folks know the answer to these challenges. And I think they really are helping us along with trying to get people there. Tim, other major questions as you're seeing pop up?
Oh, there's there are so many, but I think, some of these we'll just have to try to get answers out to at a later time.
I know one that's popped us is nursing and staffing challenges. And Dr. Hayes, you had something you wanted to add to that, I think.
I was going to help clarify that. I think, I saw it in the chat, a lot of questions about, well, why don't we just hire back the nurses that lost their jobs last year? And I don't really feel that many of our nursing staff in the community lost their jobs last year. I know many of the hospitals had strategies to keep their nursing staff and other staff employed throughout the pandemic. There were definitely staff that left the profession because of the stress of taking care of these individuals. We have seen a decrease in graduation rates in nursing schools. And so part of our shortage in not being able to take patients is not necessarily because we don't have the beds, it's that we don't have the applicants interested in taking the nursing positions. I think many of our hospitals would say that they're struggling to hire new nurses because there just aren't as many people interested in going into nursing at this time.
I think, Dr. Hayes, you make a great point. Thank you. And we also know that in no time have we seen the exit that we're seeing today of healthcare professionals from the field. They're just leaving the field. These are hard days. And if I think we're all tired of COVID, but try being a bedside nurse. I think that's more than tiring. That's just utter exhaustion right now. And I think that you have to give hats off, a shout out to all our bedside nursing team and respiratory therapists, social workers, et cetera, dietitians. These guys are really working their tail off to try and keep your community safe. The problem is that they are getting burned out. This is really hard. It has a really high death rate. These patients don't do very well, and you can't find nursing staff. You just can't find them. And I think to those people who say, well, just hire more people, right. We would be doing that. All of us would be doing that if we could. That's not our problem. Our problem is we have too many sick folks, both with COVID and without COVID. There's only one way to help us improve the burden of the COVID patients, which is exploding in our midst. And that is to get people vaccinated, but right away to bend the curve is get back on masks.
There are several questions about boosters and will we need a booster? How long do the vaccines last?
Oh, that's a great question. All right. Scrimshire, where are you? Are you out there still? Boosters, you and Hawkeye could take this question on. We hear this one a lot, and my sense is that someday we're going to probably offer boosters to people with really severe or immunocompromising disease. But by and large, 2 doses seems to still work. Do you agree?
Yeah, for most people, two doses is great. There's data showing efficacy out past 6 months at this point. I expect that to actually be a lot longer, probably closer to a year at least. But the problem is, just like we get a flu vaccine every year, there are different circulating strains. And so these vaccines aren't, they might not be as effective against future strains of the virus. So I do think that we'll have periodic boosters. And for the immunocompromised, I was on a call last weekend, and there's some good data showing that a lot of immunocompromised people and with other conditions, chronic medical conditions, don't have a great response after the 2 doses. And so the wording in that meeting was that perhaps there will be a 3-dose series for certain immunocompromised people.
Hawk, anything you want to add?
Yeah, I think I agree. There probably will be additional dosing, but I think we still have a lot of unanswered questions. So certainly in the immune compromised populations, particularly solid organ transplants and some of the other blood malignancy, we have a lot more data on that. There's also consideration of age as being a risk factor. The other issue is if we do give additional dosing, is it going to be the same vaccines? We know that the vaccines we have currently work because not only of those neutralizing antibodies, but because of those conserved T cell epitopes. But also, if you are giving additional dosing, is it going to be with the same platform? Are you going to give an additional mRNA vaccine if you've already received 2 doses of that? Or are you going to get one of the viral vector vaccines? Currently, we have Johnson & Johnson in the United States because of some preliminary data out of the UK, Germany, and another country in Europe that shows possibly maybe improved T cell responses with that mixed platform dosing. So I think there's still a lot of questions. I think we do all anticipate possibly additional dosing. It's just a matter of when and what is the regimen going to be.
Tim, yes, 2 more questions we're going to try and get to.
2 more questions. I think they're both pretty quick. One, Ahmad answered in the chat, but for the folks who have vaccine mandates or requirements, are they losing staff to other places? And so Ahmad said no. And
Mark, how about Truman?
Yeah, I mean, at this point in time, I'm not aware that we've lost any employees, but we certainly are paying close attention to that.
Okay.
And then are folks out there seeing the worried well show up in the ER? We're not. We've not really had people show up just to get a test. Our acuity is very high. Our low acuity patients is virtually none. But is anyone else? HCA was mentioned, but is anyone else seeing people showing up just to be tested?
Daryl or Bill, are you guys seeing people that show up just to be tested to the ED?
Yeah, see, Steve, it's Daryl. We had just started to see that trend change very recently. And historically, I'm not aware of that having been a challenge. But I think, at least in several of our immediate hospital service areas with the heightened uneasiness about these trends, there has been an uptick there. So we were just wanting to make sure the message was out there that there are many avenues in which to get tested. And if you're not exhibiting, significant clinical symptoms, then we would just encourage the community to seek maybe other avenues to get tested versus using the emergency department. For all the reasons we've all talked about here, our emergency departments are just chock full and typically are holding patients who are needing to be admitted.
Bill, same story.
I would agree with that.
St.
I'd agree with that. At St. Luke's, we sent out a med staff alert about 2 weeks ago. And in that alert, we described how overwhelmed our emergency rooms are and that we needed to send low acuity patients somewhere else. And we're using our convenient care clinics and our primary care clinics and our urgent care clinics and getting people tested, hopefully outside of the emergency room. I'm sure everybody on this call, our emergency rooms are really, really suffering. They're overwhelmed.
Jim, same story up in North Kansas City in the North Line, I bet.
Yeah, actually, we were seeing more of that about a year ago when people didn't have all the other options to get tested. And that's really trailed off now. The people coming in now are people who are sick, not just wanting a test.
Yeah, and I think that's a really important point. As we wrap up today's conference, I want to leave you with this number, 1,115. On Tuesday, that was the new number of tests positive in Kansas City. That's as high as it was at the height of the pandemic. The problem is that we know there's more out there than that because people are testing at home, which they didn't have an option to do before. So again, I want to say a big shout out and a big thank you to all the chief medical officers and other folks who are on this call, to our public health officials, to all the representatives here from the Metropolitan Area Regional Council, or MARC, to our own communications team for all of our health systems who have helped put this together, and to all of our elected officials and school officials and the city administrators who are on this call. You have a hard job. We all have hard jobs right now. And what we're trying to tell you is what the story is from our standpoint of what our hard job looks like, and ask for your help. Because our job will get a lot harder if we continue down this road and struggle to take care of the patients who need our help every day. And we know how to do that. And that's why we're asking for your help in trying to get that message out to all of our communities in whatever form or fashion we need to. Vaccination is the long-term answer to get out of this pandemic. Masking is the short-term answer to keep us all safe. Even if 50% of our metropolitan area were vaccinated, it's not. That means there's 1.2 million people who aren't. Well, Springfield's a metropolitan area, about 400,000. And look what's going on there from the Delta variant. And the surrounding counties in our areas aren't that much better than South Central Missouri. We saw that map of how much risk, and the risk is everywhere, and the risk is around us, and it surrounds us, and it's inside of us right here. The Delta variant is almost a whole different bug, and we have to respond in a way that will make sure we keep all of our patients safe in our community, and especially inside our hospitals and health systems. We want to be here for you. We want to be here for your children, for the adults, for our parents, for our grandparents. But if we can't take care of the patients because we have too many sick folks, then we're not going to be able to be here. And that's a scary thought that none of us wants to see. So please help us, help keep our community safe. We'll continue to go shoulder by shoulder, arm in arm, side by side with you. But we ask for your help to keep our community safe through masking and through vaccination as much, whenever, and wherever possible. Thanks to everyone for their help today, and to Joe Reardon and the Kansas City Chamber. I can't say thank you enough for agreeing to sponsor this call and letting us get up and tell our story as chief medical officers to our community. We don't seek the limelight, but we want to keep our community safe, and we want to keep everyone healthy. Thank you.